Okay, now we're gonna do neonatal seizures. So we're now in the neuro or intracranial pressure subject. So neonatal seizures. First of all, the immature brain within 4 weeks of life are more prone to seizure activity. So it's just seizures within the 4 weeks of life. So risk factors: hypoxia, which is low oxygen; infection, like meningitis; metabolic imbalances, like diabetes. But the ones that were listed, like majorly, were hypoglycemia and hypocalcemia, and then intracranial hemorrhage. So signs and symptoms are going to be subtle movements, apnea, and lip smacking. Don't get these confused with simple, like normal things that newborns do, like stretching or babbling. So treatment for this is going to be anticonvulsants. An example of one is going to be phenobarbital. So the dosage may be kind of high for newborns because they metabolize things quicker. So that's going to be expected. And then you're going to want to treat the underlying cause. You're going to want to treat the infection or treat the metabolic imbalance. So for like an infection, you might do antibiotics. And then you want to do continuous monitoring on them while they're having a seizure to prevent injury. So you want to do things like lay them sideways and time how long the seizure takes. Now we're also going to look at febrile seizures. So febrile seizures are whenever you have a rapid increase in temperature, and that's what triggers a seizure. This is the most common type for children under 5 years old. So it may be a sign of infection like meningitis or sepsis. So risk factors for febrile seizures are family history of it, males, and being between the age of 6 months to 5 years. It's the most common type. So some signs and symptoms for this one are tonic-clonic movements. So these are your typical seizures, like symptoms: stiffness, loss of consciousness, jerking, shaking. Now, because it is febrile, they're going to have high fever. So febrile fever. So it's going to be 102.2 degrees Fahrenheit and up, or 39 degrees Celsius and up. I would memorize the Fahrenheit one. It lasts less than 15 minutes, so it's very short. So it's a short duration. And then treatment of management of this is going to be, you do want to use antipyretics to lower down the fever, but you do not want to use anticonvulsants. So for the neonatal seizures, you did want to use the anticonvulsants. But for febrile, you do not want to use them because the risks for them are too high compared to what it would just lower the fever and you'll solve the problem. You can give rectal diazepam. That's usually used for like anxiety, but you can do that. So you do want to reassure the parents that febrile seizures are benign most of the time. So usually it's just because of the high fever. Due to, like, if you have an infection, you're going to have a high fever. So then you might have a febrile seizure. But it's not like a really, really big thing to worry about. You don't want to like freak out unless they're recurrent. So if it keeps happening, then you do want to take them to the ER. So you want to educate the parents on how to control the fever with antipyretics and want to take the child to ER. So you can do antipyretics, you can do like a cool cloth, a tepid bath. There's different options that you can do. But that's what your main thing for febrile seizures is: the tonic-clonic movements, the high fever, less than 15 minutes, antipyretics, not convulsants. If it's recurrent, ER. Under 5 years old, mostly.